Students with emotional and behavior disorders. Considering that many symptoms of emotional and behavior disorders are common to other disabilities, it can be difficult to determine when a child has an emotional or behavior disorder. The academic performance of students with emotional and behavior disorders may be like that of students who have a learning disability. Some students tend to engage in risky behaviors that exhibit impulsivity or hyperactivity, which may raise questions about the presence of attention deficit hyperactivity disorder, or ADHD. Other students with emotional and behavior disorders may exhibit social or communication impairments that resemble students diagnosed with autism spectrum disorder. There are different types of emotional and behavior disorders, which include anxiety disorders, disruptive behavior disorders, and dissociative disorders. Anxiety disorders include obsessive compulsive disorders, post-traumatic stress disorders, or PTSD, or social anxiety disorders. With obsessive compulsive disorders, the individuals may engage in obsessive urges and thoughts, or may compulsively engage in repetitive behaviors. Post-traumatic stress disorder, or PTSD, arises after an individual has experienced a traumatic event. Symptoms include emotional numbness, avoiding memories of the event, having nightmares, behaving in impulsive or aggressive ways, or experiencing nervousness. With social anxiety disorder, individuals may feel irrational fear about social situations. Now let's talk about disruptive behavior disorders. So disruptive behavior disorders include oppositional defiant disorder and conduct disorder. Oppositional defiant disorder is exhibited by an ongoing presence of angry or irritable moods, argumentative and defiant behavior, and vindictiveness. Whereas conduct disorder is exhibited by the demonstration of intimidating, aggressive, destructive, and deceitful behaviors that violate rules and the rights of others. Let's take a look at dissociative disorders. Dissociative disorders is the involuntary disconnection from actions, identity, memories, surroundings, and thoughts. So examples of dissociative disorders include depersonalization disorder and dissociative identity disorder. Depersonalization disorder is characterized by feeling that one is observing their life rather than living it. The individual may feel like a robot or as if they are observing themselves in a dream. On the other hand, dissociative identity disorder, also called multiple personality disorder, is when the individual may seem to exhibit split or multiple identities or personalities that control how they behave. Students with emotional and behavior disorders often find it very difficult to control their behavior and focus on their work in the classroom. It is also common for these students to lack impulse control and the emotional balance that is necessary to handle social interactions with other students effectively. Common triggers to students' problem behaviors may be the inability to effectively communicate their feelings, wants, and needs. So these students may experience receptive and/or expressive language barriers. For example, the student does not understand an assignment, they may not know how to communicate their needs for help, and as a result may become defiant, disruptive, or withdrawn. Sometimes students with behavior and emotional disorders demonstrate problem behaviors because their basic needs are not being met. There may be a situation in which the student constantly experiences neglect at home or have the responsibility of caring for themselves and others at home, and may seek attention from peers and teachers through inappropriate or disruptive behaviors while at school. When we can identify and understand the function of the student's behavior, we are more equipped to manage the behavior in positive and effective ways. It is important for educators and other professionals to provide explicit instruction in social skills and problem-solving skills when educating students with emotional and behavior disorders. It is necessary for these students to have opportunities to practice these skills to increase their abilities to effectively communicate their wants, needs, and feelings. Lessons should be carefully structured to provide many opportunities for students with emotional behavior disorders to respond, and pacing should be adjusted to maximize student engagement within the content. The classroom environment should be structured with rules and routines well established throughout the instructional year. Educators should create conditions in a classroom that promote positive behaviors, such as establishing clear behavioral expectations, teaching or modeling correct behaviors, and being consistent with implementing consequences to rules and procedure violations. Some students with emotional and behavior disorders require more specific interventions through a behavior intervention plan, or BIP, that is based on a comprehensive functional behavioral assessment, or FBA. A functional behavioral assessment, or FBA, is a systematic way of gathering information to identify and understand why the problem behavior occurs. What is the trigger? When and where the problem behavior most likely occurs, and under what conditions will the student most likely be successful? Data collected from the FBA is then used to develop the behavior intervention plans, or BIPs. Behavior intervention plans identify the problem or target behaviors. It includes a summary of the data collected through the FBAs. It includes the plan for reducing the problem behavior while increasing the desired behavior, and it identifies the process of monitoring the target and desired behaviors. So behavior intervention plans are not required to be part of the student's IEP. However, they do provide legal documentation of the intervention to be implemented. So when educating students with emotional and behavior disorders, be mindful of creating the learning environment such that it is structured with rules and routines. Also, be mindful that these students may exhibit behaviors and characteristics like other disabilities, such as learning disabilities, ADHD, or autism, or the student may be identified as having a secondary disability. Recommended educational practices for working with students with emotional and behavior disorders include positive behavior intervention and supports, establishing structure and consistent rules, providing opportunities for safe self-expression, and providing positive relationships. So Chapter 7 presents a wealth of information regarding the definition and characteristics of emotional behavior disorders, suggestions for interventions and strategies to implement, collaboration with parents and families, as well as current issues and trends in working with students with emotional and behavior disorders. It is important that we as educators and other professionals be aware and knowledgeable of these issues as we work with all students with diverse learning needs. And to apply what you learned in Chapter 7, reflect on the following questions. What are examples of internalizing behaviors? What are examples of externalizing behaviors? Why might students who exhibit internalizing behaviors be less likely to be referred for special education? What are examples of behaviors exhibited in the classroom that may suggest a student has an emotional and behavior disorder? What are some concerns among professionals regarding inclusive practices of students with emotional and behavior disorders? And what can be done to improve the outcomes for students with emotional and behavior disorders? So the purpose of this activity is to encourage deeper reflection on the content presented in Chapter 7 and is not a required assignment.